Thank you for joining us today for an introduction to global surgery and guidelines. Today's presentation is for educational purposes only and not provided as consulting, coding, or legal advice. These guidelines are cited according to Medicare guidelines. Please check all major payers to ensure you are familiar with their rules and the surgical package. This is an introduction only and not all-inclusive. The Global Surgical Package, also called Global Surgery, includes all the necessary services normally furnished by a surgeon before, during, and after a procedure. Medicare and other carrier payments for a surgical procedure includes the preoperative, intraoperative, and postoperative services routinely performed by the surgeon or by members of the same group within the specialty. Physicians in the same group practice who are in the same specialty must bill and be paid as though they were a single physician. Pre-operative visits after the decision is made to operate is typically included. For major procedures, this includes pre-operative visits the day before the day of surgery. For minor procedures, this includes pre-operative visits the day of surgery. Intraoperative services that are normally a usual and necessary part of a surgical procedure are included too. All additional medical or surgical services required of the surgeon during the post-operative period of the surgery because of complications which do not require additional trips to the operating room are included. Also included are the follow-up visits during the post-operative period of the surgery that are related to the typical recovery period as well as post-surgical pain management by the surgeon. Supplies are included with the exception for those identified as exclusions, which is determined by each payer. Miscellaneous services such as dressing changes, local incision care, removal of operative pack, removal of cutaneous sutures and staples, lines, wires, tubes, drains, casts, and splints, insertion, irrigation, and removal of urinary catheters, routine peripheral intravenous lines, nasogastric and rectal tubes, and changes and removal of tracheostomy tubes are all included when provided in addition to the surgery. Global surgery applies in any setting, including an inpatient hospital, outpatient hospital, ambulatory surgical center, or ASC, and physician's office. When a surgeon visits a patient in an intensive care or critical care unit, Medicare includes these visits in the global surgical package. There are 3 types of global surgical packages based on the number of post-operative days. The first classification of discussion is the 0-day post-operative period. 0-day means there is no pre- or post-operative days included in the surgical package, and the visit on the day the procedure is performed is generally non-payable. There are no post-operative days included for the procedure, and the visit on the day of the procedure is generally not payable as a separate service. Count the day of the surgery and another 10 days immediately after the day of the surgery to determine when the global period ends. If the patient returns for additional services after the 11th day, your office may bill for that service, such as an evaluation and management follow-up visit. 1 day pre-operative is included. Day of the procedure is generally not payable as a separate service. Total global period is 92 days. Count 1 day before the day of the surgery, day of surgery, plus 90 days immediately following the day of surgery. It is very important to understand what is generally not included in the surgical global package. Why? Well, because these additional services or items, when separately identifiable and medically necessary, can be billed in addition to the procedure. Initial consultation or evaluation of the problem by the surgeon to determine the need for major surgery may be billed and paid separately. Append modifier 57 when this service is to determine the decision for a major surgical procedure. Another item not included in the global package is the initial evaluation for minor surgical procedures and endoscopies. Visits by the same physician on the same day as a minor surgery or endoscopy are included in the global package unless a significant, separately identifiable service is also performed. In this instance, append modifier 25 to the evaluation and management service by the same physician on the same day of the procedure. We have an excellent compliance tip YouTube video on modifier 25. You can find that on the AIHC YouTube channel in our modifiers playlist. Also not included are services of other physicians related to the surgery, except where the surgeon and the other physicians agree on the transfer of care. This agreement may be in the form of a letter or an annotation in the discharge summary, hospital record, or ambulatory surgery center record. A provider may bill separately for visits unrelated to the condition related to the procedure performed. The exception is when the visit is related to a complication of the surgery. Visits related to treatments which are not part of the normal recovery, not included in the package, and can be billed separately. So when diagnostic tests and diagnostic procedures are performed in addition to the surgery, these items can be billed in addition to the global surgery. If a less extensive procedure fails and a more extensive procedure is required, the second procedure is payable separately. Immunosuppressive therapy for organ transplants is not included, as well as CPT codes 99291 and 99292 for critical care services unrelated to the surgery, where a seriously injured or burned patient is critically ill and requires constant attendance of the physician. Treatment for postoperative complications requiring a trip to the operating room, an OR for this purpose, is defined as a place of service specifically equipped and staffed for the sole purpose of performing procedures. The term includes a cardiac catheterization suite, a laser suite, and an endoscopy suite. It does not include a patient's room, a minor treatment room, a recovery room, or an intensive care unit, unless the patient's condition was so critical there would be insufficient time for transportation to an OR. A new post-operative period begins with the subsequent procedure. This includes procedures done in 2 or more parts for which the decision to stage the procedure is made prospectively or at the time of the first procedure.